predictability. The milkman, the paperboy, evening TV. Did I get delivered here? Somebody tell me, please. This whole world's confusing me. Clouds as mean as you ever seen. Ain't a bird who knows you're true. Then a little voice inside you whisper, kid, don't sell your dreams so soon. Everywhere you look, everywhere's a heart, is a heart. A hand to hold on to. Everywhere you look, everywhere's a place. Somebody who needs you. Everywhere you look. When you're lost out there and you're all alone, life is waiting to carry you home. Everywhere you look. Everywhere you look.
Oh hey, didn't see you there. I'm Sydney Wigmore,
And I'm Morgan Rackenrood.
and you're watching the Declassified School Survival Guide on how to properly use contraceptive methods. Alright, so today we're going to start with abstinence. 100% effective, guaranteed. Abstinence is the only form of birth control that is guaranteed to prevent pregnancy and any transmission of STIs. Abstinent means no genitalia, oral to genitalia, or anal to genitalia interaction. It's the act of preventing pregnancy by keeping sperm out of the female vagina. Individuals may choose to be abstinent for a number of reasons. Prevents pregnancy 100%. It prevents the transmission of STIs. There are no hormonal or medical side effects. Allows you to try new things with your romantic partner without sexual intercourse. Helps you focus on school, career, or extracurricular activities. And best of all, it's free. The main disadvantage to abstinence is that people may find it difficult to stay abstinent for long periods of time. Pressure from significant others, or just overall giving in to your sexual desires, may end your period of abstinence without being prepared to protect themselves against pregnancy or infections. Overall, just stay abstinent.
I just don't want to have kids, you know?
Rhythm. Rhythm works by couples practicing periodic abstinence as birth control, meaning to abstain from sex during the time when a woman is fertile. The trick is knowing exactly when you're going to ovulate. There are times in the month where it is impossible to get pregnant if the woman has not ovulated and won't within 5 to 7 days of intercourse. Your advantages are, when done correctly, the rhythm method can be very effective. If the egg and sperm can't meet to fertilize, there is no chance of pregnancy. No prescription is required. And another advantage is couples always have access to, and it's all natural, which means no synthetic hormones. It is equal participation, and you have time to focus on yourself. Disadvantages is the lifespan of sperm can live an average of 3 to 5 days in the body, but for some women, sperm can live in their bodies for up to 7 days. It is difficult when to plan completely safe sex, and it is very reliable. Menstrual cycles change with diet, stress, and age, and it's hard to determine your fertility. You can still get STDs, and there is no protection against sexually transmitters infections such as HIV and chlamydia and herpes.
Heck yeah.
And that's why rhythm doesn't work.
Let's talk about something else, like pulling out. Pulling out is the withdrawal method, or better known as cordis interruptus. It's a way to prevent pregnancy by keeping semen away from the vagina. It's the action of pulling the penis out of the vagina before ejaculation. actually work, as well as possible, you must do it right every single time. Always make sure to ejaculate away from your partner's genitalia. Advantages of the withdrawal method include that it has no harmful medical or hormonal side effects. It's compatible with religious beliefs, and there's absolutely no cost attached. Some key disadvantages, however, are that it's hardly performed correctly, there's a high failure rate, and there's no protection against transmitted diseases. The main reason that the withdrawal method is most ineffective is because of the male's Cowper's gland. The Cowper's gland, so it secretes an alkaline pre-ejaculation fluid that neutralizes the male urethra. Sperm can get trapped in this gland and survive for several days. It's because of this pre-cum that sperm can enter the female vagina, which makes the withdrawal method ineffective. Long story short, pulling out, is it a risk you're willing to take?
Plan B, the morning after pill. How it works? Well, it comes in a one pill dose and is taken between 72 hours and 12 hours after a contraceptive accident or unprotected sex. It prevents pregnancy by temporarily stopping the release of an egg from the ovary. This prevents fertilization. If you take it after 24 hours, it is 95% effective. After 72 hours, it is 89% effective. And the pill contains 1.5 milligrams of levonorgestrel, which is used in lower doses in many birth control pills. You can use this if you didn't use your birth control, if your condom broke, or if you skipped a few pills, or if your partner didn't pull out. Your disadvantages are nausea, you'll have abdominal pain, fatigue, headache, menstrual changes, dizziness, breast tenderness, and you may vomit. Your advantages of this, it is effective emergency backup, and it is available over the counter. It is very effective and a good use for emergency. Plan B, for when accidents happen.
Oh hey, vasectomies. Let's talk about it. Vasectomy is 100% effective and it works. A vasectomy is a form of contraception that involves surgical cutting of the male's vas deferens to prevent the transfer of sperm from the testes to the uterus. When a man undergoes a vasectomy, their sperm can no longer combine with the semen. As a result, the man still has the ability to ejaculate during coitus. The semen, however, will no longer contain sperm. Advantages of getting a vasectomy are that it only takes about 30 minutes to get the surgery, quick and easy. It's a permanent method of birth control, meaning you never have to worry about using any other kind of birth control method. It's safe and there's little complications. Disadvantages, however, are that it does not protect you against STIs, there's no going back, and you can no longer have children, no matter what. Vasectomies. Are you ready to get cut?
What are you doing? What are you doing? No. Oh my God!
The diaphragm. The diaphragm is a shallow, dome-shaped cup made of silicone. It covers the cervix. This helps prevent pregnancy by keeping sperm from joining with an egg. It must be used with spermicide cream, gel, or jelly. It's a barrier between semen and the opening of the cervix. The advantages of this is you can carry it in your pocket or your purse, and it can be used during breastfeeding. It cannot be felt by the partner. No effect on women's natural hormones, and it is immediately effective and reversible. There is no interruption of sex play, and it can be put in hours ahead of time. The disadvantages of this, it is difficult for some women to insert. It may be pushed out of place by some penis sizes, heavy thrust, and different positions. Must be in place every time a woman has vaginal intercourse. It may be refitted, and spermicide may irritate tissue and increase the risk of HIV. They cost $0 to $75, and spermicide costs $0 to $17. Living under a dome.
Oh, sorry. I was just thinking about tubule ligation. Let's talk about it. So tubule ligation is the surgery to block a woman's fallopian tubes. It's a permanent form of birth control. After the procedure is done, the egg can no longer move from the ovary and through the fallopian tube, where fertilization would typically happen. The procedure can be done at any time. The surgery involves a small cut in the abdomen and seals off both fallopian tubes by cutting, tying, or clamping them so sperm cannot meet up with the potential egg. Pros of tubule ligation are that it's a permanent form of birth control, it works, so no chance of human error, and it doesn't affect any hormones. Cons, however, include that it lasts forever, so there's no going back. It's very expensive to reverse. There is risk of accidental injury, and there is no protection from STIs. So tubule ligation. Talk about being tongue-tied, but different. Now that's a disadvantage of not using tubule ligation.
Okay. Condoms. Condoms. It's a male condoms are made from very thin latex, rubbers. Polyaspirin or polyurethane are designed to stop a man's semen from coming into contact with his partner. When condoms are used during vaginal sex, they help to protect against pregnancy and sexually transmitted diseases. A female condom is inserted into the vagina. Using the closed end ring, the other ring creates the open end of the condom. The sheath then lines the walls of the vagina, creating a barrier between sperm and the cervix. The advantage of this is they help both partners from STIs, from gonorrhea and HIV diseases. You only need to use them when you have sex, and they're suitable for planned sex. There are no side effects, and it comes in different sizes, shapes, colors, and flavors. There are 50 cents to $1 each, so it's very affordable. And the disadvantage of this are some couples find condoms interrupt sex, and condoms are strong, but they can still break. You may also be allergic to the plastic, and once a condom is used, it can be reused. Must be used from start to finish every time you have sex. The female condom is not very reliable. 30 out of 100 people get pregnant from it every year. The spermicide can cause irritation, and that increases the risk of getting HIV. Condoms. They work. Apply to head. Easy enough. What do you mean, what am I doing?
That's not how you put on the condom. Come here, I'll show ya. So first, you take your wiener. Grab a condom and apply it so the rolling end can roll down. Pinch the tip and apply it to the head of the penis. Once there, continue pinching while you roll down the condom. Once it's at the end, you're safe. Intrauterine device. Survival of the fittest. An intrauterine device, or an IUD, is a small, often T-shaped birth control device that is inserted into a woman's uterus to prevent pregnancy. It's a form of long-acting, reversible birth control. There are two types of IUDs, hormonal and copper. Both types of IUDs prevent fertilization of the egg by damaging or killing sperm. The IUD also affects the uterine lining, where the fertilized egg would implant itself and grow. Pros of an IUD include the fact that it's 95% effective. It's a safe contraceptive method, safe for any age, and there's no hormonal effects. Cons, however, include that it may cause infection, for example, gonorrhea or chlamydia, in the first 20 days. IUDs can also be expelled, and they are often associated with cramping and heavy bleeding. So whereas IUDs, it really is all about survival of the fittest.
Oh my god. Oral contraceptive. This is a way for men and women to prevent pregnancy. Women take the pill by mouth, and when taken correctly, it is 99.9% effective. This contains small amounts of man-made estrogen and progesterone hormones. These hormones inhibit the natural cyclical hormones to prevent pregnancy. Stops body from ovulating, and it changes cervical mucus to make it difficult for sperm to go through the cervix to find the egg. It changes the lining of the womb, so it's unlikely that a fertilized egg will be implanted. The advantages of this is it is one of the most effective reversible birth control methods, and it doesn't take effort or skill to use properly. This regulates menstrual cycle, reduces cramps, and does not interfere with intercourse. It may also decrease acne, reduce risk of ovarian cancer, and may reduce perimenopausal symptoms. The disadvantages of this is you take it every day at the same time, it contains hormones, and it may cause irregular bleeding or spotting. The effectiveness can be reduced by other medications, and it should not be used by women over 35. It may increase the risk of blood clots, and it doesn't protect against STIs. It may also cause mood changes, not suitable for breastfeeding women. Oral contraceptive, the act of controlling birth.
AIDS, also known as acquired immune deficiency syndrome, is a disease in which there is severe loss of cellular immunity in the body, lowering resistance to infection. AIDS is caused by the human immune deficiency virus, HIV, and can be spread via the exchange of bodily fluids. AIDS is the final and most serious stage of HIV. HIV is a unique RNA virus capable of infecting the cells of the immune system. HIV targets helper T cells, eventually killing them. Due to the massive loss of helper T cells in the body, a victim of AIDS becomes vulnerable to unusual opportunistic infections. Patients who suffer with AIDS and die from the disease likely pass due to an opportunistic infection, life-threatening illnesses, and/or cancer. Common symptoms of AIDS include fever, sweating, swollen glands, weakness, and weight loss. There is no cure for AIDS, however, there are several treatments available to delay the progression of the life-threatening disease. AIDS.
Gonorrhea. It causes infections in the genitals, rectum, and throat. You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea, or if a pregnant woman gives the infection to a baby during childbirth. Symptoms is a burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles, increased vaginal discharge, or vaginal bleeding between periods. The anus symptoms are discharge, anal itching, soreness, bleeding, or painful bowel movements. A urine test can tell you if you have gonorrhea. Treatments is talk to a doctor about it and they'll give you the right treatment. Take all the medication your doctor prescribes to cure your infection, and medication for gonorrhea should not be shared with anyone. If not treated, you can get scar tissue that blocks fallopian tubes, ectopic pregnancy, infertility, pelvic abdominal pain. Gonorrhea. Try and dodge this.
Syphilis. Syphilis can be divided into 4 stages: primary, secondary, latent, and hereditary. You can get syphilis by direct contact with any syphilis sore during vaginal, anal, or oral sex. Sores can be found on or around the penis, vagina, anus, or in the rectum, on the lips, or in the mouth. Syphilis can also be spread from an affected mother to her unborn baby. Syphilis can be cured with the right kind of antibodies. However, treatment might not undo any damage that the infection has already done. Symptoms for each stage include sores beginning to appear, usually firm, round, and painless. Sores typically last 3 to 6 weeks and heal regardless of whether or not treatment has occurred or not. Rashes or sores start to appear. Fever, swollen lymph glands, sore throat, hair loss, headaches, weight loss, muscle aches, and fatigue are other symptoms. Affected organs such as heart, blood vessels, the brain, and the nervous system are also affected as well. It can damage internal organs and can result in death. Syphilis.
Herpes. A common sexually transmitted disease that a sexually active person can get. Most people don't have symptoms. Genital herpes is an STD caused by 2 types of viruses, either simplex type 1 and 2. About 1 in 6 people aged 14 to 49 have herpes. Transmission. You can get herpes by having vaginal, anal, or oral sex with someone who has the disease. Fluids found in herpes sores carry the virus, and contact with those fluids can cause infection. You can also get herpes from an infected partner who does not have visible symptoms because the virus can be released through your skin. The symptoms include blisters around your genitals, rectum, or mouth, body aches, swollen glands, smelly discharge, or burning when urinating. The treatments for this are, really there's no cure actually for herpes, but there are medicines to prevent or shorten outbreaks. One of these herpes medicines can be taken daily, and it makes it less likely that you will pass the infection on to your sex partner or partners. Don't touch sores or fluids or other people that have it. Wash your hands after that. Genital warts. They are growths on the skin of the genital area and around the anus. It's caused by human papillomavirus, and warts can appear in the mouth or genital area. These cause pain, discomfort, and itching. There are 70 types of them, and they can transmit from skin to skin. Symptoms of this are growths on different parts of the body, including the penis, scrotum, groin, thighs, inside and around the anus, in the vagina, and the cervix. Warts appear on the lips, mouth, tongue, and throat. It causes vaginal discharge, itching, bleeding, and burning. The treatments for this cannot be eliminated once in your bloodstream. It can go away over time, and you can get wart treatments. You can get surgery to remove them, and have often pap smears to see if you still have them. Genital warts.
What's your opinion on contraceptive methods? I think you need a lot more education about it.
I agree.
Sir. So what's your opinion on contraceptive methods?
Whichever one works best for you, I guess.
That's a good answer.
Agreed. Thank you.
Awesome, thank you. What is your opinion on contraceptive methods? It's basically birth control.
I agree.
Yeah.
Thank you.
And that was the Declassified School Survival Guide on how to properly use contraceptive methods.